Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Are there certain types of cancer that are unique to men?
There are two cancers that are unique to men. Prostate cancer is common in older men. Testis cancer tends to be common in younger men, both of which are important health concerns, especially if you're someone who develops these cancers. So prostate cancer involves approximately 200,000 men in the United States every year. It's been a very controversial topic because many men with prostate cancer don't need treatment, and therefore the screening policies and the screening techniques have changed over the last decade. Testis cancer affects a much smaller group of men. Only about 8,500 men in the United States will have testis cancer diagnosed this year. It tends to involve men between the ages of 15 and 35, although in theory any age group can be diagnosed with testicular cancer. There is no defined screening for it. It tends to be picked up usually incidentally. A man or his partner will feel something abnormal within the testes. Occasionally a doctor doing a yearly physical will pick up something as well, but it's usually self-diagnosed as compared to prostate cancer, which would require more screening to diagnose at an earlier stage.
So how prevalent is testicular cancer?
Testis cancer is on the increase. The rates in the United States have been increasing over the last generation. No one's quite sure why, but obviously thoughts come down to toxins in the environment, diet, and other types of issues. But there's definitely been an increase in testicular cancer in the last generation, and it's something that men should just be aware of.
Should one self-examine for testicular cancer?
The idea of self-examination for testicular cancer has some controversies associated with it. Most urology and urology groups do recommend occasional self-examinations. Other groups, such as the family practice physicians, the American College of Surgeons, aren't as definitive or positive about it. The problem is that it's never been studied in enough detail where there's any evidence to show that self-examinations have improved earlier diagnosis. On the other hand, there are no studies which have shown that it hasn't improved diagnosis. With most cancers, the best results are if you diagnose a cancer earlier. Testis cancer is the same as with all other cancers. The earlier you diagnose it, the better you do overall. Fortunately, testicular cancer is an extremely treatable cancer. About 95% of men who develop testicular cancer across every stage possible will be cured of the disease. If it's found at an early stage, the cure rates are close to 100%. And they're combinations of surgery, radiation, chemotherapy, or just surveillance as treatment and management strategies for testis cancer.
What are some risk factors for testicular cancer?
There are certain risk factors that can predispose someone to testicular cancer. If one has a male relative with testicular cancer, that slightly increases the risk. If one is born with a testis that hasn't descended or dropped into the scrotum by the time one is an infant, that also increases the risk of testis cancer. For those men, they need to be aware that there's a slightly increased risk. One could instruct them on self-examination and, more importantly, just the awareness of knowing that they're at risk for testis cancer. Now, self-examination, which again has not been accepted across the medical spectrum, does involve feeling one's testes. There are two parts to the testes within the scrotum. There is the testis itself, which is where the sperm production happens, and next to it is a structure called the epididymis, which is where the sperm mature and eventually come out the vas deferens. And if one develops a cancer, it almost exclusively involves that solid sort of testicular part of it. And so the idea is to, one, be able to feel the difference between the two structures, and it's very clear. The epididymis and the vas deferens almost feels like a little spaghetti, almost like a little cord, whereas the testis feels much more like a rubber ball. And so one, to be able to feel the difference, and then to feel, usually by rubbing between the thumb and the forefinger, the testis, and just feeling for anything abnormal, whether it's an area of hardness or firmness. Most testis cancers present as a mass, a painless, asymptomatic firmness or mass in the testis.
If you feel something is not quite right, what should you do?
The first step once feeling something abnormal would be to talk to a doctor. One of the concerns and why this has not been recommended widely for all men to do is that there are other conditions that can cause changes in the feel of the testis. There can be fluid collections, there can be cysts, there can be other issues, and a lot of groups are concerned that by feeling those, there might be more anxiety, might be more concern over what's really a benign condition. But if someone and their partner felt a lump or a hardness within the testis itself, I would recommend they get seen by a doctor. If the doctor confirms that it's abnormal, we would probably get an ultrasound and then kind of evaluate things from there.